If a few nanograms of a specific bacterial poison ever bypass your skin and hit your bloodstream, you will drop into septic shock, suffer total organ failure, and die within hours. It is called an endotoxin. It is so lethal and so common that it is the single greatest threat to modern medicine, which means every vaccine you have ever received, every injectable drug, every surgical implant, and every IV drip hanging in hospitals across the globe had to pass a ruthless safety test before it was allowed near your body. There is no workaround. If a medical fluid fails this test, it does not ship. It is an absolute gate standing between global pharmaceuticals and the human population. And for over 50 years, there has been exactly one way through it. It requires the blood of a living animal, not a lab rat, not a cell line grown in a petri dish. A creature that has existed, virtually unchanged, for 450 million years. Older than the dinosaurs, older than trees, older than the asteroid that wiped out the prehistoric world. It survived 5 mass extinctions in the geological record, until it met us. Here is the part nobody tells you. The blood of this one ancient animal is the hidden foundation of $1 trillion global industry, and the right to harvest it belongs to just 4 companies on the entire planet, not 400. 4. They control the supply. They set the price. All syringes, vials, and vaccines pass invisibly through their hands before reaching yours, which raises a question that should be far more famous than it is. How did 4 corporations come to own a biological choke point on all of human medicine? And why is the creature that makes it possible suddenly disappearing? To answer that, you have to start with the blood itself. The horseshoe crab is not a crab at all. It is closer to a spider, a living fossil with 10 eyes and a heavy helmet of shell. When you cut it, it doesn't bleed red. It bleeds a milky, electric blue, because its blood transports oxygen using copper instead of iron. But the color isn't what makes it priceless. It's what that blue fluid does the instant it meets bacteria. It clots violently and immediately, trapping the invader in a wall of gel and sealing it off before it can spread. Nobody set out to build a medical empire on a sea creature. It began with a puzzle. In the 1950s, a researcher named Frederick Bang noticed that horseshoe crabs infected with certain bacteria were dying strangely. Their blood had turned almost solid, clotting from the inside out, entombing the bacteria in a uniform mass of jelly. He had stumbled onto one of the most sensitive biological alarms on Earth. Blood that detects bacteria instantly, in vanishingly small amounts, and slams shut around them. By the 1970s, this reaction was refined into a standardized test called LAL. The test is capable of catching endotoxins at a level closer to spotting a single grain of poison in an Olympic-sized swimming pool than anything a normal instrument could manage. Nothing engineered in the half-century since has matched its precision. There was just one catch. You cannot synthesize it from scratch. You have to extract it directly from the animal, and a single quart, which is roughly 1 liter, sells for around $15,000, making horseshoe crab blood, drop for drop, one of the most expensive liquids on Earth, and the entire global supply still has to come out of a living crab. Which brings us back to those 4 companies. This isn't a monopoly born from a brilliant proprietary invention. These corporations don't own a secret formula. They simply own real estate. By securing state-issued permits to the specific, concentrated coastlines where these ancient creatures crawl ashore to spawn, they effectively privatized a global ecological resource. From an economic standpoint, the horseshoe crab is the perfect corporate asset. Because it cannot be successfully bred or farmed in captivity, its supply is naturally bottlenecked by nature. And in economics, absolute scarcity equals absolute pricing power. As long as the global medical supply relies on a wild animal that only crawls onto a few specific beaches in North America and Asia, these 4 entities maintain a permanent, unassailable grip on the market. They don't just supply the product, they own the gate. So each spring, when the crabs haul themselves ashore to spawn, a ritual they have performed since before the continents drifted apart, the boats are already waiting. Hundreds of thousands are scooped off the beaches, packed into dark trucks, and driven to sterile laboratories. This is where the ancient world meets modern industry. The crabs are rinsed, sorted, and clamped onto steel racks in long, claustrophobic rows. They are folded open like books, their pale, segmented undersides turned up beneath harsh fluorescent lights. A technician slides a thick needle directly into the soft tissue surrounding the heart. The electric blue blood runs down into glass bottles, draining up to a third of the animal's total volume. The crab sits entirely motionless, suspended in a stainless steel matrix, emptied one drop at a time. When the bottles are full, the survivors are loaded back onto trucks, returned to the coast, and tipped back into the surf. And then, in many cases, the loop repeats. A crab released this year can be caught and drained the next, and the one after that, bled repeatedly across its life, season after season as it tries to breed. The industry calls it a blood donation, a minor inconvenience. The official mortality rate, they claim, is around 15%. But here is what that number leaves out. Many crabs don't die on the rack. They die days later, drifting in the surf, too weak to feed or swim, where no one is tracking them. Independent studies have found that survivors return to the ocean disoriented, and that bled females are far less likely to ever reproduce again. The real toll is almost certainly higher than the figure on the corporate brochure, and the brochure is the only figure anyone is required to report. None of this slows the harvest, because the market has no reason to care. There is no approved substitute. If your product enters a human body, regulators require the crab test, full stop. This means pharmaceutical companies worldwide are captive customers of those 4 specific corporations, buying a liquid that can only be drained, one animal at a time, from a handful of beaches on a single coastline. That is not a supply chain. It is a hostage situation, and it would be one thing if there were truly no other way. But there is, for over 20 years. In the late 1990s, a molecular biologist named Jikling Ding set out to do something the entire industry assumed was impossible. She had spent years studying the single protein at the heart of the crab's clotting reaction, a molecule called factor C that fires the instant it touches bacteria. She asked a deceptively simple question. If the magic is just a protein, why do we need the animal at all? So she rebuilt it from scratch. Using genetic engineering, she recreated factor C as a synthetic protein, manufactured in a lab without touching a single crab. They called it recombinant factor C, or RFC. No beaches, no boats, no needles in the heart, no dying animals. It was a test you could brew in unlimited quantities, free from seasonal scarcity, free from ecological destruction, and free from the batch-to-batch variation that comes from harvesting a wild animal's blood. In trial after trial, it did exactly what the crab blood did, just as sensitive, just as reliable. The problem was solved. The animal could be retired. After 30 years, the bleeding could finally stop. The story should have ended right there. It didn't. Because to the 4 companies protecting their territory, a problem that's been solved is a revenue stream about to die. If the safety test can be brewed synthetically in a standard laboratory vat anywhere on Earth, the geographic bottleneck vanishes. The natural scarcity they built their empires on disappears. A synthetic alternative turns a heavily guarded, billion-dollar biological choke point into a cheap, generic commodity overnight. So the industry did not celebrate the cure. It buried it. To keep control, they didn't need to prove the synthetic test was dangerous. They just had to make it look complicated. They funded doubt. They demanded more studies, then more, insisting on decades of redundant validation data. They reframed a closed scientific consensus as an open safety risk, utilizing the exact playbook tobacco companies used against cancer research and oil conglomerates used against climate science. You don't have to prove the alternative is faulty. You just have to keep it under review long enough to keep billing your customers for the old way. It came to a head in 2020. The U.S. Pharmacopeia, the regulatory body that decides which tests the entire domestic industry is allowed to use, finally voted on whether to accept the synthetic alternative as an equal to crab blood. They voted no. Sit with the structure of that decision for a second. The system that profits from bleeding the crab was handed the power to decide whether the crab still needed to be bled. An industry with billions of dollars riding on the answer got to shape the rules, and unsurprisingly, the rules came out in its favor. The foxes weren't just guarding the henhouse. They were on the committee. Europe didn't wait. the European pharmacopoeia approved the synthetic outright. Drug giants began breaking ranks. Eli Lilly validated it and then advocated for it, and others followed. Not a single scientist could find a technical reason it didn't work. Because there wasn't one. The only thing standing between the synthetic alternative and the end of the harvest was money. So the boats still go out. Every spring, hundreds of thousands of crabs, needles in the heart, a third of the blood, and the survivors limp back into a sea where their numbers have been falling for decades. Worse, the biomedical harvest isn't even the only thing draining them. For generations, commercial fishermen have chopped horseshoe crabs into bait by the millions, hacking them apart to lure eel and whelk into traps. Between the boats that bleed them and the boats that butcher them, an animal that outlived 5 mass extinctions is being pulled down from 2 directions at once. And this is where the story stops being only about a bled animal, and becomes something much harder to undo. Because if horseshoe crabs were the only ones paying for this system, it would already be disturbing enough. But they aren't the only victims. Pull this single creature out of the ocean in large enough numbers, and an entire web of life begins to come apart with it. Starting with a bird most people have never heard of. Each May, a small rust-colored bird called the red knot lands on the beaches of Delaware Bay, halfway through one of the longest migrations on the planet, nearly 10,000 miles from the tip of South America to the Arctic. It arrives starving and skeletal, with about 2 weeks to refuel before its final push north. It survives on one thing: horseshoe crab eggs. The timing isn't luck. For thousands of years, the crabs have spawned at the exact moment the birds arrive, blanketing the sand with billions of tiny green eggs right as the most exhausted travelers in the animal kingdom touch down. These eggs are a biological superfood, packed with exactly the kind of high-density fat and protein the birds need to instantly double their body weight for the brutal flight ahead. But when you bleed the crabs, the math collapses. Because the harvested females are lethargic, weak, and disoriented, millions of them simply fail to spawn when they hit the beaches. The density of eggs in the sand has plummeted. Instead of a thick, continuous carpet of nutrients, the beaches are becoming barren. Pull the crabs out of that equation, and the chain snaps. Fewer crabs mean fewer eggs, leaving a starving bird on an empty beach with nowhere left to go. The red knot is already listed as threatened. Its population a mere fraction of what it was a few decades ago. And the collapse doesn't stop with one bird. The red knot is just the canary in the coal mine. When the crab egg supply vanishes, it triggers a domino effect across the entire coastal ecosystem. Other struggling shorebirds, like ruddy turnstones and sanderlings, are pushed to the brink of starvation alongside them. Beneath the waves, the crisis deepens. Dozens of species of juvenile fish, including winter flounder and striped bass, rely on these exact same microscopic eggs as their primary fuel source during critical growth spurts. By starving the beaches, the harvest is effectively hollowing out the marine nurseries of the Atlantic coast. An industry bleeding crabs to test drugs has, without anyone ever consciously deciding it, wired the survival of an entire oceanic food web to the price of a pharmaceutical reagent. And the animal holding both ends of that wire is vanishing. Step back, and the shape of it is almost too clean. The cure exists. It works. An entire continent already uses it. The only reason the needles keep sliding into the hearts of these animals is that someone, somewhere, would make slightly less money if they stopped. The horseshoe crab survived the Chicxulub asteroid. It survived the ice ages. It survived every catastrophe the planet could invent across nearly 500 million years. And it may not survive a quarterly earnings report.